How does Parkinson's disease affect speech and swallowing? Imagine trying to speak clearly or swallow smoothly when your muscles are no longer working as they should. Parkinson's disease affects these functions because it causes movement to slow down and become smaller over time. This happens because the disease disrupts how the brain controls muscle movements, especially in the face, mouth, throat, and chest areas. When it comes to speech, many people with Parkinson's notice their voice becomes softer or more monotone. Their speech might sound breathy or hoarse, and words can seem slurred or mumbled. Sometimes, sentences trail off at the end, making it hard for others to understand. Some individuals have trouble finding the right words or starting sentences, and their speech may become either very slow or sometimes rapid, with stuttering or stammering. Because Parkinson's can reduce facial expressions, it can be harder for others to read emotions, which affects nonverbal communication. These speech changes happen because the muscles involved in forming sounds and producing voice are affected by impaired muscle control. Additionally, cognitive changes related to Parkinson's can make it harder to retrieve words or organize thoughts, further impacting speech. For swallowing, Parkinson's disease can cause a condition called dysphagia, which means difficulty swallowing. This can range from mild to severe. The disease causes stiffness, slowness, and weakness in the muscles of the jaw, tongue, and throat. As a result, chewing becomes harder, moving food around in the mouth is more difficult, and swallowing can become unsafe. Automatic swallowing reflexes may become less effective, increasing the risk of choking or food entering the airway, which can lead to serious issues like aspiration pneumonia. Some people develop a repetitive tongue movement called tongue pumping, which interferes with swallowing. Excess saliva, or drooling, is also common, but it is often due to impaired saliva clearance rather than overproduction. These speech and swallowing problems can significantly affect quality of life by making communication and eating more challenging. Early evaluation by speech-language pathologists is crucial to identify and manage these issues. Treatment options include speech therapy to improve voice volume, clarity, and communication strategies. Swallowing therapy involves exercises, techniques to compensate for difficulties, and sometimes modifying food textures to reduce choking risks. Managing these symptoms helps maintain social connections, proper nutrition, and overall health. In summary, Parkinson's disease impacts speech and swallowing by impairing muscle control and coordination in the face, mouth, and throat. This leads to challenges in speaking clearly and swallowing safely. Early intervention and ongoing therapy are essential to help people with Parkinson's maintain their communication abilities and enjoy eating comfortably. Always consult healthcare professionals for personalized advice, as individual experiences with Parkinson's can vary widely.